Welcome to the Healthy Kids, Healthy Future Innovation Competition. I'm Stephen Collins. I'm the CEO of Matter. We are very proud to be working with Parkview again on an accelerator for the fourth year in a row. This year, looking at solutions to help kids and teens better manage their chronic conditions. Matter has worked with a lot of health systems in the 8 years since we've been in operation, and the work that we do and that we continue to do with Parkview continues to be very special. It brings together all of the things that we're passionate about. Our core belief at Matter is that collaboration between entrepreneurs and industry leaders is the best way to innovate in healthcare. And what Parkview cares about is building the right collaborations to improve the health of the people they serve. As an incubator of healthcare startups, we've worked with more than 850 companies since we launched in 2015, including a number that have worked with Parkview. In aggregate, our member companies have raised more than $5 billion to fuel their growth, and their technologies have already gone on to improve the lives of hundreds of millions of people. We also work with a number of health systems around the country, as well as life sciences companies and payers, helping them create a more human-centered healthcare system. We help organizations unlock the value that can be created from collaborating with entrepreneurs, as well as from nurturing the most innovative personnel from within their organizations. And in each of the last 4 years, we've worked with Parkview on an accelerator focused on various aspects of maternal and child health. We've received applications from 200 startups who want to work with Parkview. And importantly, Parkview has continued collaborations with 6 different solutions that we've identified through these programs and helped to develop. This year, our focus has been on kids and teens with chronic disease. According to the CDC, more than 40% of US children have at least one chronic condition or liability. And the management of these conditions can be taxing on both the children themselves, obviously, as well as their guardians. For the last 3 months, the 8 companies that have been part of this year's cohort have worked closely with us and with Parkview to refine their solutions and proposals. And today we are delighted to introduce you to these 8 companies. Thanks so much to the team from Parkview, who's been instrumental in the planning and the oversight and the execution of this challenge. Jolynn Succo, who we'll hear from in a moment, Ethel Masting, Spencer Perkins, Alyssa Ehringer, Leslie Adair, and Charlotte Gabet in particular. Thanks as well to all the judges of this year's innovation competition who spent their morning talking with each of the companies. I hope that you all enjoy the presentations. I hope you're inspired by the potential for these solutions to improve the lives of kids and teens. And before we launch into those presentations, I want to introduce Jolynn Succo, who is the Senior Vice President, Chief Innovation Officer for Parkview. She has been a wonderful thought partner and champion of innovation within Parkview and beyond. And we work with a lot of health systems all over the country. And the way that Parkview approaches and delivers innovation under Jolynn's leadership is truly exceptional. Jolynn will tell you all more about this program and the work that is being done at the Miro Center. So Jolynn, turn it over to you.
Thank you, Stephen. It's wonderful to be here yet again and for another 4th year. I'm excited to share with all of you a little bit about Parkview Health and who we are and why we innovate. So by way of a little bit of background, we are a 10, soon to be 11 hospital system in Northeast Indiana and Northwest Ohio. We have 1,000 member of employed provider group. We have a small health plan. And what's near and dear to my heart is the Miro Center for Research and Innovation. And within the Miro Center for Research and Innovation, we host a team that executes approximately 200 clinical trials a year. We have a unique multidisciplinary team of applied health services researchers with expertise in user experience, social science, psychology, and computer science. We have our innovation program, and we have a state-of-the-art simulation lab. We are both the largest employer in our region, as well as the safety net provider in our region. That gives us a very unique dual role as as an important driver of economic development, but also community health. And we take both of these roles very seriously. We are not an academic health center, but I like to think of us as a supercharged community hospital with years of coworkers that have incredible technical expertise delivering care to patients across rural and urban settings. I really want to welcome all of our competitors. While we have technical expertise, you bring us new ideas and help us think differently and outside of the box. Our partnership with Matter has always been designed to help address some of the most significant public health issues in our region and in our world. And with that, I would like to turn it over to Ethel Massing, our innovation program leader, to give you a little bit more information.
Thank you, Jolyn. I'm really excited to be here today. This is really just the beginnings of our innovation competition, and I'll talk about that in a little bit, how this is going to continue after today. But we are so excited to present our 8 semifinalists to you today. They're doing amazing work in the pediatric space. Like Stephen said at the beginning, this couldn't be done without a team, and we really want to thank the Matter team of Stephen, Sam, Olivia, Emma, and Kay for making this possible. Our team here at Parkview, Jolyn, Charlotte, Alyssa, Spencer, Lindsay, Leslie, Adrian. We could not do this program without you. It is definitely a team effort, and we love our partnership with Matter. So here on the innovation team, we really have 4 pillars of work that we do. Many of you or most of you know us for this global innovation competition series that we run, but we have other work that we do throughout the year as well. First is really internal innovation within the health system. So we are helping to solve problems that clinicians bring to us. We're also incubating clinician and coworker ideas and taking those through the commercialization process. Outside of the competition, we'd love to work with startup companies. All those resources Jolyn talked about, the hospitals, the providers, the researchers, we really want to support people bringing new solutions to our patients. And so we really help connect startup companies to those services through pilots, through research, through trials, through clinical viability studies. There's lots of ways we'd love to help this community. Again, we do host this global innovation competition series each year, and then 3D printing and production is also part of our program. So like Stephen said, this is the 4th year of our competition. We have been really excited to focus on big health problems and trying to find solutions to them. So we started in year 1 in the midst of a pandemic with the Healthy Mom and Baby Innovation Competition, where we really looked at infant mortality, moved into maternal mortality, then maternal and child health, and then this year focusing specifically on pediatric health. So over the life of the competition, we've had 186 entrants from 29 different states and 19 different countries. And people often ask me, what comes out of these competition? What ends up happening? Well, like Stephen says, we're continuing to work with competitors, not just winners. We've done we've done pilots. We are currently in the midst of pilots with some of our companies. We're planning studies. Last year's winner, Mark O'Sullivan from Neurobel, he was just here last week doing work with our research team and planning his study. And so the work that happens that you see today continues throughout the year and continues on through various years. I will say one of the proudest competitors that we've had was one that came from Parkview in year 1, and that was safe sleep simulation. And as of August 1st, we had been, so they came to us with an idea. And as of August 1st this year, we've been delivering babies, these infant safe sleep models, all over the United States for 1 year now. So we just celebrated our 1-year anniversary of this company. So we are so proud of the work we're doing and so proud of the work that our competitors do to bring these solutions to the people. So like it's been said, this year's competition is all about pediatrics. And here at Parkview, obviously, we care about our kids. Healthy kids turn into healthy adults, and that's what we want for our community. We are especially excited about children, as was just announced with our recent collaboration with Cincinnati Children's, and we're proud to be able to soon offer their services at our hospital as well. So this year, again, we focused on children, especially those with chronic conditions like asthma, diabetes, and mental health issues. And so we really asked the question, how can we better support children and teens manage their chronic conditions? So like I said earlier, today isn't the end of the competition. It's really just beginning for these semifinalists that you see today. So in July, we looked at all the submissions we got for the year. We picked 8 semifinalists that you're going to see today. And this is that innovation competition. Today, there will be one winner who wins $10,000, but there'll also be 3 to 4 other companies chosen to participate in an accelerator. And this is really a time where our team, where Matter, works with them to connect those people with experts who can help drive their solution forward and really plan for the pilot project that they want to pitch to Parkview. So in November, we'll have a session where we have our finalists pitch and we select who we're going to do a pilot with. We were so lucky today to have 6 fantastic judges. This was probably one of the closest competitions we've ever had. The semifinalists are wonderful. You're going to love them. And our judges put them through the ringer and asked terrific questions. So they were Dr. Taisha Blair from Atlanta. She's a pediatrician. Kristen Eilenberg, who's the entrepreneur in residence for Elevate Ventures. Leslie Hill, who's the program director for WEAC at the Northeast Indiana Innovation Center. Julie Keck, who's a managing medical director for Anthem. Uma Veerapan, who is a senior associate with Blair Capital, and Jason Whitney, who's the vice president of venture development with IU Ventures. Again, we thank our judges. We could not do this without them. So now what you've been waiting for, presentations from our 8 semifinalists. So we are going to start with Lindsay Watson with Augment Therapy from Cleveland, Ohio.
Hello, everyone. Thank you so much for having myself, Lindsay Watson, and the Augment Therapy team here today. We're proud to present Augment Therapy. What we do, in short, is we gamify exercise, and we do that both for clinical healthcare providers as well as the general wellness interested user in the market. The reality is that physical therapy and exercise is often a painful and prolonged prescription for the vast majority of people diagnosed with chronic conditions. I know that because I'm a physical therapist myself, and I've been practicing for over 20 years. For the vast majority of the children that I would treat, physical therapy and exercise is painful and uncomfortable and something they do not want to do. So what we have built is an evidence-based exercise application that's accessible from your smart device that truly engages patients of all ability levels and all ages in active exercise. The truth is, the numbers of children being diagnosed with chronic conditions and developmental disabilities are exploding, and technology can help us transcend these barriers. Our solution not only uses augmented reality experiences to engage patients in exercises, but we also use computer vision in real time. This actually tracks the body position while the user is engaged in what they believe to be a video game, while we are capturing simultaneously data on their exercise performance and can send that back to the healthcare provider in any setting and at any time. This informs and empowers the healthcare provider to make better decisions for these children dealing with these chronic conditions. We are so excited for the opportunity to work with Parkview. We see a vast opportunity in researching the impact of exergaming solutions on individuals with chronic conditions. And we have some pretty amazing partners, including Sesame Street, where kids can actually exercise alongside Cookie Monster and Elmo. We're also a Unity for Humanity Award winner. We're proud to be working alongside CareSource, and we've been participating in KidsX, which is a digital health accelerator as well. I'll show you this video now, which shows an example of what we can do. This is a patient who dislikes exercise, and you can see her actively participating in exercise through our application. We're excited to duplicate these kinds of results in Parkview and other locations. Interested, please contact us. Thank you.
Thank you, Lindsay. Next up, we have Sam Gardner with Happy Pillar from Austin, Texas.
Hi. Okay. So I'm Sam Gardner. I'm the CEO and co-founder of Happy Pillar. Our mission is to improve the mental health of kids and families everywhere. We provide evidence-based therapy tools to parents of children between the ages of 2 and 7, empowering them to support their kids' behavioral health in just 5 minutes a day. As you know, children's mental health is an urgent need. 1 in 5 kids is battling a mental or behavioral disorder, but only 20% of these children have access to care. When a child's mental health is ignored, their physical health takes a toll and their academic performance plummets. They're even at greater risk for substance abuse and suicide. But despite the clear need, family mental health resources are out of reach for most. Our solution is Happy Pillar, an innovative app that provides mental health care to children via the most important people in their lives, their parents and caregivers. Our treatment involves daily therapeutic sessions that only take 5 minutes. These can be done anywhere at any time. Happy Pillar guides these sessions, instructing parents on non-directive play and communication techniques that have been proven to help kids with depression, anxiety, ADHD, and behavior challenges. During these sessions, Happy Pillar listens and analyzes using AI, including speech recognition and natural language processing. Happy Pillar then provides personalized real-time feedback, just like a therapist would. As parents continue to use these therapeutic tools, kids begin to show new behaviors and healthy coping mechanisms. 98% of parents who use Happy Pillar with their children see an improvement in their child's mood or behavior within 3 weeks. We're aware that over 115,000 Indiana children with a mental health disorder did not receive treatment in 2022. That number grows to 3.85 million children when looking at the entire United States. We want to get Happy Pillar into the hands of every parent with a child between the ages of 2 and 7, starting with Parkview families. With Parkview and Matter as partners, we can ensure that more children have access to a high-quality mental health resource. We can also free up clinicians to focus on cases that need a higher level of care. You can help too. Visit our website, download our app, and please share Happy Pillar with parents or pediatricians that you know. Together, we can bring Happy Pillar to millions of children. Thanks.
Thank you, Sam. Next up is Beth Rogozinski from Toronto, Ontario, with Acoustics.
Thanks very much. And again, I'm Beth Rogozinski with Acoustics, and looking forward to presenting to you today. Did you know that over 2 billion people globally have or are at risk of liver disease? And this number is expected to rise dramatically in the coming years, driven by the obesity epidemic, which is causing a rise in fatty liver diseases. UCLA Health estimates that fatty liver affects up to 46% of the US population, and it's affecting our children at alarming rates as childhood obesity has risen significantly in the last few years. Especially for young people, this is a dangerous condition that increases their risk for diabetes, other chronic conditions, and all-cause mortality. Current preventative approaches to catch and diagnose these types of liver disease early are complex and time-consuming, with several appointments and specialists involved. They're expensive and minimally available, and often involve high-end imaging like MR, or they use highly invasive biopsies. But there is a better way. Let me introduce you to the Onyx. The Onyx is a complete liver surveillance and diagnostic solution for point-of-care liver evaluation. Our solution was developed on over 6,000 patients, and it offers a unique, inexpensive approach to quickly examine a patient's liver. Within minutes, any clinician or care team member can perform the exam and get quantitative results. Acoustics makes the complex, expensive, and invasive process of diagnosing structural liver disease seamless, painless, and done in 5 minutes. Acoustics is a software-only solution that leverages a rise of new low-cost ultrasound systems with a very unique approach. We mine the sound in ultrasound and enable ultrasound to go beyond what can be seen by the human eye and provide quantitative insights by comparing these acoustic biosignatures to patients in our database with known and confirmed disease, making this a valuable point-of-care tool that can be carried in your pocket. With these low-cost systems, we can deploy an end-to-end solution for under $5,000 and charge a per-scan fee that gets reimbursed via existing CPT codes. So clinics and clinicians get reimbursed as they improve the lives and the health of their patients. These types of point-of-care assessments are critical for youth and adolescents because kids at risk for liver disease are not being seen or considered. And studies show that young people have a significantly higher risk for the most egregious form of fatty liver disease, NASH. Studies also show that earlier the onset of the disease, the worse the progression over the lifetime of the patient. But studies also show that if caught early, liver disease can be reversed, and we can set the child up for a healthy adult life. Our solutions address major aims of healthcare, decreasing costs, improving patient and physician experiences, and directly addressing a major population health issue while advancing health equity. I hope you'll join us in our quest to revolutionize healthcare and advance better health for our nation's children. Thank you.
Thank you. Now we're going to hear from Kamaya Fombi from Fort Wayne, Indiana, with One Day at a Time.
Hi guys, my name is Kamaya Fombi, and I am the inventor of One Day at a Time. One Day at a Time is an innovative mental health app designed to empower teens and young adults with a sense of belonging and community. One Day at a Time connects users to resources, coping skills, and inspiration as they navigate the struggles of daily life. In 2020, an estimated 5.6 million adolescents aged 12 to 17 in the United States had at least one major depressive episode, and the number continues to grow. 60.3% of youth with major depression do not receive any mental health treatment due to lack of resources and availability. Parkview 2022 Community Health Needs Assessment states that in Indiana, Allen County has the greatest number of deaths to suicide. In Allen County, 10% of youth under the age of 13 attempted suicide as well. I struggled with my mental health all of middle school until my freshman year of high school. It was difficult to be completely open about everything I was feeling at times. I wanted to lean on someone, but didn't want to carry that burden as well. The constant feeling of drowning in my own thoughts between homework, bullying, and home life were extremely overwhelming. Although I had open communication at home, a guidance counselor at school, and a therapist I saw weekly, I felt like everyone was only getting a piece of the story and no one really understood me. I believe this app will help create solutions for struggling teens who feel like they aren't being heard. The different platforms create safe places for teens to remove the mask and openly discuss and find solutions to help. One Day at a Time provides a supportive community for teens to show that they are not alone. This app is designed for teens and those who service them. We will be available on personal devices, at schools, and through medical providers. The app can be downloaded on a personal device that is not associated with a facility or organization. People from all over will be able to connect to one another to share stories and uplift each other. Educational institutions can offer the app to all students connected with school counselors for individual communication. They will also be able to connect with peer groups for encouragement. Mental health professionals will be able to encourage users with skills learned in sessions, track treatment plans, and hold users accountable. This will allow more consistent treatment and targeted care. We strive to empower those who struggle with mental health by providing a healthy place for them to express themselves to other supports in their lives, while providing coping skills and resources to let them know they are not alone. One breath, one day, unlimited time, one day at a time. Thank you.
Thank you, Kamaya. Now we'll hear from Francesca Watke of NEN from Barcelona, Spain.
Hi, everyone, and thanks so much for allowing us to present and share a little bit more about NEN. I'm Francesca Watke. I'm the founder and CEO of NEN, bringing evidence-based solutions to kids with cancer to help them manage their pain. I founded NEN to help kids, their families, and healthcare providers manage their pain through evidence-based solutions. Every year, 500,000 kids are diagnosed and treated for cancer. 47 kids will be diagnosed with cancer today in the US alone, and nearly all of these kids will experience pain. So every day, a parent is dealing with a child in pain. Imagine you're that parent. You would do anything to help, but what can you do? Traditionally, you would give them progressively stronger pain medications, but that could create problems leading to dependency in the future. A second option is to provide the child with pain management therapy. Unfortunately, there are too few psychologists to help kids, and even fewer that are trained in pain management. The average wait times for an appointment in the US exceeds 6 months. But what if there were something that could help a parent help their child in the moment? Something to help them cope, learn to manage how and why they're feeling pain, and take the necessary steps to make it better. NEN is based on cognitive behavioral therapy, CBT. CBT helps you change the way you think and act in order to change the way you feel. It's not play for distraction's sake. NEN is based on proven approaches to enable kids to control their pain. By leveraging play, we can improve how the child responds to their pain. Led by virtual companions, Sarah, Tony, and Dolores, NEN offers a series of interactive journeys, games, and activities that change how kids think about their pain, building lifelong skills that help them measure and cope with it, and learn not to just live with it, but lessen it. And they can do it from a phone or a tablet right away. NEN is being tested in the clinic at top pediatric hospitals in the US and Europe. 15 hospitals have proactively expressed interest in working with us. This validates our approach and the unmet need that NEN serves with the stakeholders that are closest to serving these kiddos. This is why we're really excited to work with Matter and Parkview, so we can pilot NEN in different hospitals and in different settings. We're planning a head-to-head study to clinically validate that we've translated our CBT modules correctly to our platform and to have initial hints at effectiveness. We'll also be testing our patient experience via human factor studies. Collaborating with such an innovative group that's already so experienced working with startups is a huge advantage for us and will give us tremendous momentum to help us help more kids. We're measuring the effectiveness and continue to refine the product in time for our planned launch early next year. Help us expand to other age ranges, conditions, and countries worldwide. Once clinically validated in cancer, we'll be studying other conditions that cause pain in kids, like irritable bowel, migraine, aplastic anemia, sickle cell disease, burn, congenital malformalities, and orthopedic and other post-op applications. NEN empowers parents to help kids in pain help themselves when they need it the most. Kids matter, and we're committed to kids. Train the brain to beat the pain. Do you want to help kids manage their pain? Feel free to reach out. I'd be happy to share more about NEN. Thank you.
Thank you so much. Next up, we have Kalina Kalyan of Chicago, Illinois with Sakare.
Hi, everyone. It's so nice to meet you. My name is Kalina Kalyan, and I'm the founder of Sakare, a type 1 diabetes self-management platform designed for teens. Studies have shown that 87% of teenagers with type 1 diabetes struggle to manage their type 1 diabetes, and this can lead to negative downstream health outcomes. 50% of type 1 diabetics will develop issues like diabetic retinopathy, neuropathy, or hypertension early on in their 20s. As a type 1 diabetic myself, I know how difficult it is to manage type 1 diabetes, especially during the transition from being a teenager living at home to transitioning to living as a young adult independently as we go off to college or pursue other paths. There are very few resources outside of family and providers that help to prepare type 1 diabetics for this type of transition. That's why I created Sakare. Sakare is an app that rewards teens for taking healthy actions like pre-bolusing, meditating, and physical activity that lead to overall lower A1C levels. Habits are easily logged through users' personal habit trackers, and points earned through the consistency of habits can be redeemed for a financial reward. Sakare rotates rewards and offers monthly challenges that are designed to help create lasting habits. In addition to a rewards platform, Sakare provides educational resources like YouTube-style videos and a community tab that allows type 1 diabetic teens to connect with other type 1s. New content is published each week and includes actionable steps that teens can implement in their day-to-day. Content includes topics like preparing healthy meals and snacks, how to refill prescriptions in case of an emergency, and requesting accommodations in school or work settings. Sakare's community tab motivates teens through providing a feed of healthy habits their friends are engaging in and offers team challenges where teens can earn more rewards when they're consistent with healthy habits as a group. Sakare delivers these features through an app that is easy to use, fun, and highly interactive. Managing type 1 diabetes will never be easy, but by helping teens establish healthy habits prior to leaving home, Sakare provides teens with a sense of ownership and independence around their diabetes management while increasing their confidence in managing their type 1. We're on a mission to make the transition to living independently easier and more accessible for type 1 diabetics. Through personalized rewards, educational resources, and community, Sakare empowers teens to self-manage their type 1 diabetes in ways that are engaging and informative. Thank you so much, and please feel free to reach out to me via the contact information on my slide if you have any questions.
Thank you. Next up is Wealthy with Dr. Stephen Moyo from San Diego, California.
Hi, I'm Dr. Stephen Moyo, CEO and founder of Wealthy, a company that's focused on delivering health and education equity to America's most vulnerable families. I like to say I'm a first-time founder, but a three-time immigrant. I was born in Zambia. I moved to the UK, grew up in Canada, and then came to the US for my medical training. It's while at Michigan State University, I was accepted into a program called Leadership in Medicine for the Underserved. It trained physicians like myself to work with underserved communities, delivering health education and care coordination. I got to work with and learn from communities like Flint, Michigan, Saginaw, Michigan, but also got to go abroad to places like Peru and El Salvador. It's from my lived experience as an immigrant, as well as this formative experience as a physician, that I saw the impact that community health workers have on underserved families. These people became my heroes. And Wealthy is a platform that really empowers these heroes to deliver care to kids and their families. We connect to youth in settings where youth and families are showing up most, schools and camps. And we do so authentically by sharing with them health education and connecting with them around the things that they love. These builds trust and relationships that enables our heroes to ask the important questions, capture essential family data, and assess and analyze a family's strengths and needs. As with these insights, they can then refer families to the resources that they need. They can do this on our platform and ultimately engage the whole family, because we know this, the kids are the most powerful force for change in their home, their school, and the community. And if you want to change the behaviors of the family, you have to go bottom up through the kid. Today, we're focusing this care model on youth mental health. And that's because we're in the midst of a youth mental health crisis. Over 500,000 visits to our emergency departments have happened in the past year because of youth and mental health crisis. I invite you to connect with us at Wealthy. You can scan the QR code that's in this corner, and you can check out some of the health education content that we're creating. The video that you'll see is a 1-minute trailer for a longer 8-minute episode that focuses in fact on COVID-19, but we'll be taking this informative asset, putting it into schools with a focus on youth mental health education. Because our goal is to increase health literacy around mental health, decrease the stigma, and start to plug youth into the resources that they are vetting and curating on our site today. So I want to say thank you to Parkview Miro. I want to say thank you to Matter for having us and all of the collaborators and other companies that are on this call. We look forward to hearing from you soon. Thank you.
Thank you. And now, last but not least, Dom Rabin of Exploro from Cleveland, Ohio.
So hi everyone, my name's Dom Rabin and I'm the CEO of Exploro. Back in 2011, my then 13-year-old daughter was diagnosed with cancer. Thankfully, she's now cancer-free, but when she was ill, nobody told her what to expect, and that made her feel scared, anxious, and alone. And her experience led me to realise that the information needs of young patients are grossly underserved, leading to increased anxiety, which in turn can result in poorer health outcomes. But a lack of information doesn't just impact a patient's mental health, it also increases costs for providers with longer appointments, more repeat procedures, more frequent use of sedation, and more missed appointments. So that's why we developed Exploro, an interactive patient education platform that uses an avatar guide, 3D interactive experiences, and a set of games to help young patients feel engaged, empowered, and informed whilst having fun at the same time. Think of it as Pokemon Go meets The Sims. Firstly, the patient creates an avatar which becomes their guide through their healthcare journey. The guide introduces the child to unfamiliar hospital environments and procedures using 3D augmented reality interactive models, and multiplayer games allow the child to learn about various medical concepts. A calendar and mood diary enable the child to take control of their day, and the guide can also answer any questions the child might have. And to do this, we've built our own conversational agent that uses synthetic phonics to recognize when children misspell words. To make sure all our information is clinically accurate, we work closely with physicians to co-develop content. And to ensure the content is age appropriate, we have an amazing expert advisory board. They're a group of children aged 8 to 16 who vet everything we do, and they tell us when we've got things right, but also, and crucially more important, when we're off the mark. So does Exploro work? Well, a recent research study found that children using Exploro demonstrated a statistically significant reduction in procedural anxiety, as well as statistically significant increases in both patient satisfaction and knowledge about procedures. But the best endorsement for Exploro's power to improve the pediatric patient experience comes from the parent of a 12-year-old being treated for osteosarcoma. She sent us a long message describing how Exploro helped her son, but there was one section that I'd like to leave you with today. It read, "The very next day, in his 4th round of chemo, he shared with his nurse that he finally gets what this medicine is doing to his body, thanks to a game he played on the app the night before. It was amazing. He was encouraged, and for the first time in months, there was a lightness about him." Thank you.
And thank you. And I want to just take this time to thank all our competitors for all your hard work, for your presentations. As I hope all of you on the webinar today can see, we had a really tough decision in front of us. These are amazing groups of people doing just amazing work to try to help children with chronic conditions. So like I said before, there will be one winner today of $10,000, but up to 4 other teams will be moving forward through the accelerator program and have a chance to pitch to Parkview for a pilot. So really, without further ado, we will go ahead and announce the winner. So the winner of today's competition and $10,000 is Happy Pillar. So Sam, if you want to get back on and say a few words.
I just want to thank everyone so much from Parkview, Matter, the Happy Pillar team. This is, incredible. We're so excited to do the accelerator and to learn from everyone and to get to know more of these other companies that'll join us in the cohort. And just thank you all so much. This is so exciting.
Thanks, Sam. We are looking forward to working with you and the others that are chosen for the accelerator, and they'll be hearing from us soon. As for the rest of you on the webinar, you can keep in touch with us as well by following us on Facebook, LinkedIn, or X, formerly known as Twitter. You can see our handles there. You can also drop us a line at innovation@parkview.com. Maybe you're a founder of a startup company who would love to work with us, or you want to work with one of the companies you saw today. Feel free to reach out to us. Thank you again. Thanks to Matter. Thanks to our team for making this all possible. Thanks for joining us today. And congratulations, Happy Pillar.